Here at Recreational Sports, safety is key. The safety of our participants is the #1 concern in our programs and facilities. As a team member, you have the responsibility of maintaining a safe environment as well as assisting anyone who is in need of care. During this training session, we will go over some emergency protocols and cover some situations that may occur while you are on the job. Join us as we review our safety and risk management training. All team members at Recreational Sports are required to be certified in basic first aid, CPR, and AED skills. Recreational Sports and several local agencies provide training courses each month as well as recertification courses. It is your responsibility to maintain current certifications and provide your supervisor with an updated copy of your certification cards. If your certification expires during the semester, you will be removed from the schedule until you are recertified. Here is a list of common injuries that occur in our facilities and programs. It is important to familiarize yourself with these injuries so you are prepared to provide care should an injury occur during your shift. Each of our facilities have fully stocked first aid kits. Here is a list of some key items within the kits. Safety associates and supervisors inspect the kits weekly to ensure that they are always ready for the next use. An AED is an automated external defibrillator that is used to analyze and treat potentially life-threatening cardiac arrhythmia. AEDs work by electrically shocking the heart. Rec Sports currently has 14 AEDs. The AEDs are located at the control desks of the Southwest Recreation Center, Student Recreation and Fitness Center, and the Broward Outdoor Recreation Complex, in the guard rooms at Florida Pool and O'Connell Center Pool, in the mechanical rooms at Broward Pool and Graham Pool, in the boathouses at Lake Wahlberg North Park and South Shore, and in the field sheds at McGuire, UVS, Southwest Softball Complex, and Southwest Fields. There is one mobile AED that travels with the athletic trainers. In the event of an emergency, you must remain calm, act swiftly, and give care prudently. The first responder should not leave the ill or injured person, but direct someone to the nearest phone or blue light phone. Rec Sports staff should provide crowd control and keep the crowd away from the ill or injured person and potential dangers. Emergency action steps have been created to assure that each emergency is taken care of appropriately. The 6 steps are as follows. Step 1, recognize that there is an emergency through witnessing the event, unusual sights, sounds, smells, or behaviors. Step 2, assess the situation by checking the scene to determine if it is safe to approach, and then check the ill or injured person to determine the level of injury so appropriate care can be given. Step 3, call EMS if the level of injury indicates an ambulance is needed or at the request of the ill or injured person. To reach EMS, dial 911. Step 4, provide care within the scope of your training. Step 5, complete the injury report form. The final step is the follow-up, which consists of contacting your supervisor and cleaning the area and equipment. It is imperative that the radios only be used for business and emergency situations. Remember, not only will you hear the communications on the radio, but those around you will also hear them. It is very important that you speak in a clear and concise manner, use sensitive language and terms to maintain a professional environment, and display sound judgment when discussing sensitive information. To operate the radio, first turn on the radio by turning the volume control knob to the right until an audible beep is heard. Then adjust the volume to a level that allows you to hear it at all times. To initiate communication, push and hold the talk button, located on the side of the radio. Wait for 1 to 2 seconds, then begin talking by stating your position or area, followed by who you are intending to contact. release the talk button after you are finished speaking. Here is a sample conversation.
Aquatics office to student rec facility operations.
Now the person on the receiving end will then communicate back to indicate they have received the call.
This is facility operations. Go ahead.
We have heard thunder and see dark clouds coming towards us from the south. We are closing the pool at this time.
10-4, student rec pool. Have you seen lightning yet?
No, just thunder. Clear.
Once this communication has been established, no other communication should be started until the current conversation has ended. There is an exception in the case of a code red. That communication should go as follows.
Indoor soccer to athletic trainer.
This is the trainer. Go ahead.
I have a code red. Cardiac incident.
Call an ambulance and begin CPR. I'm on my way.
At Rec Sports, we have developed an injury level system that will allow team members to communicate the type of injury as well as the urgency of response without compromising the ill or injured person's privacy. The injury level system also allows those with a radio to be aware of the seriousness of an injury in other areas so they can prepare if their assistance is required. Remember that people respond to being injured differently. So what may seem like a minor injury to you may be very traumatic for the ill or injured person. Regardless of the injury, it is always appropriate to ask the person if they would like to have an ambulance called. A level 1 injury is considered to be a minor injury that is a common occurrence. Some signs and symptoms that may occur are as follows. A small scrape or laceration from sliding into a base playing softball. There will be very minimal bleeding, if at all, but the wound needs to be cleaned and bandaged. A jammed or sprained finger from blocking an underwater hockey shot with no deformity, but some pain or discomfort. Minor strains and sprains are also considered to be a level 1 injury. For example, a participant twists their ankle. They are in a small amount of pain with minimal swelling and bruising and are still able to walk. Level 1 injuries are not limited to just the ones we have talked about here. Use good judgment and always err on the side of caution. Level 2 injuries are considered to be injuries of moderate severity. Some signs and symptoms that may occur are as follows. A moderately swollen and bruised ankle that occurs after a sprain. Bleeding that needs to be controlled due to a cut. Any minor head injury that does not involve a loss of consciousness. Also, any deformity of a digit, such as a dislocation of a finger or toe. Level 2 injuries can escalate to a code red if symptoms are not treated appropriately. Level 3 injuries are considered to be urgent or severe injuries. These types of injuries require immediate attention and in some instances may require EMS for further medical care. Injuries of this type may quickly escalate, so proper care and attention are crucial. Some signs and symptoms that may occur are as follows. Obvious deformity from a fracture or dislocation. Heavy bleeding from a cut that is more than ½ an inch long or appears to be deep. Any type of injury to the head where the player has lost consciousness, is vomiting, or has become ill from the injury. High impact injuries to the chest or throat, such as a collision that results in breathing difficulty. An injury where the person shows signs of shock, such as abnormal changes in body temperature, irritability, dizziness, nausea, flushed skin, and altered levels of consciousness. Treat for shock in all injuries. Level 3 injuries can escalate to a code red if not treated immediately. Code red injuries are life-threatening. The signs and symptoms of these injuries are unconsciousness, not breathing or gasping, no signs of circulation, damage to the head, neck, or spinal column, severe bleeding, any injury where life is at risk, the first responder needs to report that the injury is a code red. Remember, during a code red, all communications from non-involved areas must stop immediately until cleared. The first responder and their assistants will implement the emergency action protocols by calling an ambulance, responding with a first aid kit and AED, and providing care until EMS arrives. Code red notifications are reserved for life-threatening emergency situations only. When contacting the EMS operator, it is important to speak slowly and calmly during the phone call, providing all the key information that is on the screen, as well as any additional information the operator may request. Remember, do not hang up until they tell you it is okay to do so. Here is an example of an emergency phone call.
I would like to request an ambulance. My name is Ali Kassam, and I'm an operations supervisor at Southwest Recreation Center, Building 316. The address is 3150 Hull Road in Gainesville. We have an adult male injured on Court 5 with a lower leg fracture. Our staff is providing care and monitoring vitals. As of the last report, he was conscious and breathing, and we are sending a staff member to the parking lot to meet the ambulance.
All right, an ambulance is en route. Make sure you have someone with the victim.
Yes, ma'am. Thank you very much.
With any injury or incident, it is important to provide proper emergency care and document the events. Recreational sports has two major forms that must be completed. The injury report form is a legal document that must be filled in completely and correctly in ink. No matter how big or small the situation, you must complete this form. Injury report forms are used to document care provided to an injured or ill individual while participating in any of our programs, activities, and facilities. This form will be entered into our database and can help track specific injuries and possible trouble spot locations in our facilities. Additionally, this form will assist with any possible lawsuits and/or court appearances. The top section is where you will fill in the ill or injured person's general information. This information is vital and can be found on their Gator One card, by asking the ill or injured person, or talking to their friends. Have the injured person sign the report. The middle section is where you will record information about the injury. Check the box if an ambulance was called and to which hospital the individual was taken. Advise the injured person to seek further medical treatment and discontinue activity if necessary. Check the appropriate boxes to signify where the injured person was referred for treatment and whether they continued activity against recommendations. Sign as the personnel on duty and obtain a witness signature. Fill in the injured person's name along the right side of the form. The last section is to be completed by the athletic trainer if they treated the ill or injured person. It may also be used as additional information space if no athletic trainer was present. Once the information is completed, please give the pink bottom copy to the ill or injured person and place the white copy, white and yellow if an athletic trainer was not present, in the orange or blue HIPAA bag and send to the Recreational Sports Safety Risk Management Office. When there is an incident with a participant in any recreational sports facility or program, it is our responsibility to document that incident completely and clearly. An incident report form must be completed by a recreational sports team member only. Always remember to print clearly and use ink. To fill out the incident report form, record the date, time, facility, and location within the facility where the incident occurred. Print your name and phone number in the Staff on Duty section. List the names and phone numbers of witnesses in the Witnesses section, preferably not recreational sports team members. Describe the incident from beginning to end. Include names and UFID numbers when possible, or give descriptions of involved parties. Remember to use facts, not personal commentary. Describe the action taken by the staff. If the University Police Department, or UPD, was called, list the name and badge number of the responding officer. Once the information is completed, please place the incident report form in the orange or blue HIPAA bag and send to the Recreational Sports Risk Management Office. If the incident includes an injury, then an injury report form must be completed and turned in with the incident report form. As a team member of recreational sports, we must take responsibility for the safety of our members while in our facilities. When you hear the fire alarm or an announcement over the PA system requesting evacuation of the facility, listen to your radio for directions from a designated rec sports team member or full-time staff member. Depending upon your location in a rec sports facility, you will follow a specific path of exit to a designated staging area. Once there, you will continue to monitor your radio for directions. Do not re-enter the facility until cleared by EMS personnel. As a team member, remain calm and orderly. Be familiar with your work area and which area to direct our participants to evacuate. Listen for additional directions from the PA system or by radio. Remain in the designated staging area until notified. Be sure to take the following items with you: two-way radio, first aid pack, AED if one is present in your area. With the variety of facility and program hours, the student staff is likely to be in charge during an emergency situation. The after-hours protocol designates a recreation manager, operations supervisor, and possibly other members of our rec sports team to be in charge during the situation. In case of a major emergency, it is important to contact the full-time supervisor of that area as soon as possible. Remember, first take care of the situation at hand and then contact the appropriate full-time staff member. During any major injury or emergency situation, especially when EMS has been notified, we must be prepared to deal with questions from bystanders and the media. As a team member involved, do not comment on the situation, but direct them to a full-time staff member or UF spokesperson. You must be aware of privacy issues as well as liability issues that may occur for the ill or injured person and staff involved. You must also be aware not to spread any information and to avoid rumors. If you are injured while at work, you should notify your supervisor or professional staff member immediately. Complete the recreational sports injury report form. Call Workers' Compensation at 352-392-4940 as soon as possible to open a claim and follow their advice for care. Notify the Assistant Director for Safety Risk Management that Workers' Compensation was called and give details about the incident. We hope that you have enjoyed this overview of the safety and risk management guidelines here at Recreational Sports. All of this information is vital to the success of our programs and facilities here at the University of Florida. Your individual staff training will have more detailed information about the sections covered in this training session and can be referred to at any time should you need more information. We look forward to working with you in the near future.